Hello everyone, welcome to WKRG News 5's Facebook page. The doctor is in today and we are joined by Dr. Trevor Stubbs. He is the orthopedic surgeon with Bayside Orthopedic Sports and Medicine Rehab. Thank you so much for being here with us this afternoon. We really appreciate it. Absolutely. I'm trying to load up our video here on Facebook so I can read you guys' questions. But before we get started, I just kind of wanted to ask you, for the viewers that might have knee problems, what is the most common reason for that?
Absolutely. So, and thank you again for having me. The question of what's most common certainly depends on the patient's age. For adults, especially as we get older, the cartilage can start to wear down, and so the answer is arthritis. And that can typically present with pain and soreness around the knee. It typically gets worse with activity, and patients can have stiffness, especially after being seated for long periods of time. And this typically gradually gets worse over time.
And you mentioned arthritis, which, you know, we all hear about. I'm pretty sure everybody's heard about it in their lifetime. But what exactly is it for the people that don't really know?
Yeah, so cartilage at the basics arthritis at the basics is a lack of cartilage. And so if you look at the picture here on the left, cartilage is the smooth and shiny end at the bone. And over time, as that cartilage can wear out, there starts to be there's breaks in the cartilage, and that causes increased friction, which causes pain. Arthritis can certainly present with multiple factors, like bone spurs.
And now that you mentioned bone spurs, what exactly are bone spurs, and how do you get them?
Yeah, so bone spurs are something that we see on X-ray, which indicates that the patient has some signs of wear and tear, like arthritis. The bone spur isn't actually the problem, but more of a sign of the problem. Other things that we see are things like loss of the joint space and sclerosis or hardening of the bone.
Good deal. And thank you guys again for joining us. We are here on Facebook Live talking about knee pain and knee issues today. And you can ask your questions here on Facebook. We're going to be asking a couple other questions that, you know, we've talked about. And so if you guys have any specific ones, go ahead and ask them on the Facebook page. And we'll, of course, ask them here today. So what about people with knee injuries? If somebody has an injury, how do they know when to see a doctor and if they have to see a doctor?
Yeah, and that's a great question. If somebody has a fall and they have significant pain or are unable to put weight on that leg, you know, the concern is that they might have a fracture, and that is something that they ought to come in and get checked out for, because the fracture might need treatment. Other signs and symptoms that we look for are things like continued pain or swelling that extends for several days, things like the inability to straighten or bend the knee, or things like buckling or locking or catching of the knee.
And if somebody breaks a bone, what else can be damaged if somebody is injured like that? Yeah,
so there's the knee is a pretty complex structure, and there are lots of ligaments inside of the knee. So for instance, the ACL is one of the more commonly injured ligaments, and it's here in this picture in the central part of the knee. You can also damage other ligaments in the knee, the meniscus. You can damage the patellar tendon or the quad tendon. You can have knee dislocations or damage the cartilage.
Well, a lot of damage that can be done there.
Yes, of course.
So I know that, you know, what we are talking about today is knee pain and knee problems. But what can be done to prevent any knee pain or problems? Is there something that can be done for that?
Yeah, knee prevention, prevention of knee pain is incredibly important. And one of the most important things that you can do is weight control and weight management. Certainly by losing a few pounds, we're decreasing the amount of force that goes through the knee, which is going to be really helpful for the long term. Other things include flexibility and strength, and trying to avoid high impact activities, but instead do some low impact activities like swimming or biking or elliptical.
And we have a question here from Facebook from Brent. He hyperextended his knee playing sports over 20 years ago. Could that be a result of his knee pain now?
Absolutely. And so there are some injuries that, especially with these hyperextension injuries, that might cause some ligamentous damage that you can kind of get over, but because of that subtle instability over a long period of time, that potentially has caused some increased wear and tear. And so absolutely, problems can definitely be experienced a long time after the injury. And
we're getting some more questions here on Facebook. You can ask your questions on Facebook, and we'll be able to ask the doctor here as the doctor is in. Is it better to heat or ice knee pain?
Yeah, so I think when somebody's in the what I would call the acute inflammatory response, so when somebody's having a lot of pain, I prefer ice to try to help with pain and swelling. When the problem tends to be more stiffness, then I like heat to help kind of loosen things up and help get things moving. Certainly it's patient preference though.
Good deal. So it's whatever feels best for you.
Whatever feels best. Those are just my preferences.
Good deal. So somebody else is asking on Facebook, why does the very front of my knee hurt usually after the exercise?
Yeah, so the anterior knee pain is extremely common and really common in actually many different age groups, especially once we get as an adult. One of the more common causes of anterior knee pain is wear and tear of the cartilage underneath the kneecap, and people typically feel that right there on the front. There are some other causes of anterior knee pain that are probably most commonly found in younger females, which are typically treated with physical therapy and bracing.
So what's something that viewers who have knee pain can do if they don't want to do surgery?
Yeah, so the non-surgical treatment is certainly preferred, but one of the really important things is to have an accurate diagnosis and know what's going on. And so some of the treatment options that we have include things like rest and activity modification, icing, oral medications, bracing, physical therapy, and injections. But again, we really have to know what's going on to make the best treatment plan for that.
We've got a couple more questions here from Facebook. And again, if you're watching on Facebook, you can go ahead and ask your questions, and I'll ask Dr. Stubbs here. So do you treat non-sports related injuries or problems?
Absolutely. I did a fellowship in sports medicine and have done some extra training in taking care of the injuries and problems that are common with athletes, but we are certainly happy to help and treat injuries that are more wear and tear related, which are things like the arthritis, but absolutely.
So someone is asking, do you treat cartilage restoration?
Yes, that was a special part of my training that I did in New York, and cartilage restoration is a really great option for surgery treatment for some people. These patients typically are a little younger and very active, and they most importantly they have a isolated single lesion in their cartilage, and I believe we have an image for the cartilage restoration, but the procedure is very good in the sense that we are able to remove the damaged cartilage and unhealthy bone and then replace that with healthy bone and cartilage, sometimes from a donor.
And someone is asking if they can get a cortisone shot when their knee is sore. Is that something that would be advised?
Yeah, I think a physical exam and probably getting a set of x-rays is really important to see what's going on. But a cortisone shot can be really helpful in calming down the acute inflammatory response and really helping out with pain control.
And what about supplements? Is that something that can be helpful?
Yeah, so that's a great question, one that we get very commonly. The two most common supplements on the market are based off of glucosamine and chondroitin. These are both naturally occurring substances that are found in the body that we think are important for cartilage formation, repair, and preventing the degradation. And so as far as supplements go, the long-term studies really haven't found any benefit yet as far as preventing arthritis or curing arthritis. But we do know that as supplements, they can be helpful as far as having an anti-inflammatory response. We also know that there's very few side effects in taking them. And so I think that they're a good option for if patients are interested. Of note, they're not regulated by the FDA, so it is important to do your research and purchase from a respectable manufacturer.
Someone on Facebook is saying that they had a Baker's cyst behind their knee that was removed, and they still have some pain after getting knee surgery back in 2016. What can they do to help deal with that pain? Yeah,
that's so frustrating, and I'm sorry to hear that. Baker's cysts are essentially a collection of fluid in the back of the knee, and one of the main questions is, why did that fluid collect? And so that fluid can collect because of a meniscus tear or because of damage to the cartilage. And so typically if that Baker's cyst recollects, we still need to figure out what's causing that fluid to be there. But certainly an evaluation sounds like it's in need.
And so there are some patients that I'm sure are thinking about having their knee replaced. How long can that knee replacement actually last?
Yeah, so the best data that we have out there shows that about 90 to 95%, there's about a 90 to 95% chance that the knee replacement will last 10 years. And that goes down to about 80 to an 85% chance that it'll last 20 years. Here's a picture of what a knee replacement looks like. And that's essentially where we resurface the ends of the bone with metal implants and then a plastic or polyethylene spacer in between those two metal implants.
So another question here from Facebook, what type of knee injuries do you see most and how do you treat them?
Yeah, so we see all kinds of knee injuries, really in all age groups. Certainly we see a lot of high school athletes that are injured during their sports, whether that be football or basketball or soccer. But then we also see your young adults and even older adults who have falls or who are injured while doing their activities. Certainly, again, we're going to evaluate what's going on with x-rays and MRI if needed or whatever advanced imaging, and then go from there to make the best treatment plan.
And if you're watching us on Facebook Live, you can ask your questions. I'm reading them off this iPad now. So if you have any, you can go ahead and ask them for Dr. Stubbs. And we were just talking about knee replacements. I want to ask you about robotic assisted joint replacements. How does that work?
Yeah, so I think that robotic assisted joint replacements are a really great application of technology into medicine. And so the way that works is we make a 3D model of the patient's knee, and then using computer software, we're able to plan the surgery ahead of time. And then that software, the surgery can be adjusted in surgery, but then we use the robotic arm is the way to implement that plan from the computer and then place those implants precisely in the right position in the patient.
So what if someone were to tear their ACL? I know a lot of sports fans have seen several football players tear them in the recent years. Does that need to be fixed for the average person?
Right, so it depends a little bit on the patient, but in general, you know, the ACL is critical for knee stability, especially in twisting and pivoting type injuries. And so if the patient's young or wants to, or really no matter the age, if they want to continue an active lifestyle, then we generally recommend reconstructing the ACL. That's usually done with some tissue from the same leg of the patient, like either their part of their patellar tendon, their hamstrings, or their quad tendon.
So we have another question here from Facebook. They're asking, when is a good time to have knee replacement if your doctor tells you you're too young for one now and you've already had several surgeries on it? Yeah,
that's a really difficult problem and one that we hate to see. And so there are some other surgical options out there short of knee replacement. Sometimes if you're a candidate for that cartilage restoration procedure, that's really good because we can bring in new cartilage to help assist with the gliding and the motion of the knee. There are other things like osteotomies and things where we cut the bone to help shift the weight. Again, all to help with knee pain and knee function, short of a knee replacement. And I have one last question for you here. At what age do people most experience knee problems and knee pain? Yeah, I would say it's probably a bimodal distribution, meaning we see certainly patients as they're young and growing, especially as they're maybe being overactive with sports and things, and are more likely to have injuries. And then we also see a lot of the older population that have just been working their entire lives and been busy, and things have kind of caught up to them, and they come in with some gradually onset pain. All right, and thank you so much for being here, Dr. Trevor Stubbs, the orthopedic surgeon with Bayside Orthopedic Sports and Medicine Rehab. We very much appreciate you joining us here this afternoon. Thank you. Thank you.